heard the phrase tissue expansion system. Would you explain that and why and when you would use that, what that is?
Well, tissue expansion in general is a process that is performed to expand skin and sometimes even muscle, to expand soft tissue, very often to accommodate an implant. So we perform that for breast cancer reconstruction after a mastectomy. We'll place a tissue expander, which is basically a saline-filled, or now these days we have air-filled devices that work automatically, but those devices are gradually expanded and filled with saline or with air. The process is not just stretching muscle and skin, it involves stimulating the body to regenerate soft tissue and muscle and skin. Once that process is completed, then we'll go and replace that space has been created with an implant to reconstruct the breast. So there are also external tissue expander type of devices. We use those devices specifically when we're trying to augment a breast with fat transfer. Well, we'll expand, as we saw in the graphic before, we'll expand the skin and fat and muscle even, the soft tissues of the breast, and once we've created more space, then that can enhance the result we achieve with a fat transfer, basically create a larger recipient site to accept more fat and transfer of grafting.